How to remove acne at home in 2 weeks. Removing acne in just 2 weeks can be challenging, as acne is a complex skin condition that may require more time to fully resolve. However, you can take steps to improve your skin and reduce the appearance of acne within that time frame. Keep in mind that individual results may vary. Week 1. Establish a consistent skincare routine. Cleansing. Use a gentle, fragrance-free cleanser twice a day, morning and night, to remove excess oil, dirt, and bacteria from your skin. Avoid scrubbing vigorously, as this can irritate your skin and make acne worse. Avoid eating oily things. Apply cold packs for your skin as they relax the skin muscles and the skin gets fresh. Salicylic acid or benzoyl peroxide. Apply an over-the-counter acne treatment containing either salicylic acid or benzoyl peroxide. These ingredients can help unclog pores and reduce inflammation. Bacterial infection may cause swelling on the face that is very painful. Start with a lower concentration to minimize the risk of irritation. Moisturize. Apply a lightweight, oil-free, and non-comedogenic moisturizer to keep your skin hydrated. Keep yourself hydrated as water is necessary for our body elements. Even if you have oily skin, it's essential to moisturize to prevent your skin from overproducing oil. Sunscreen. Apply a broad-spectrum sunscreen with SPF 30 or higher every morning, even if you're not going outside much. Acne treatments can make your skin more sensitive to the sun, and protecting your skin from UV damage is crucial. Week 2. Continue and add spot treatments. Spot treatment. If you have specific acne spots, you can use a spot treatment with a higher concentration of salicylic acid or benzoyl peroxide directly on those areas. Be careful not to overuse it, as it can be drying and irritating. When you are dehydrated condition, your skin gets dried, which is a very painful condition. Avoid touching your face. Avoid picking or squeezing acne lesions, as this can worsen inflammation, cause scarring, and spread bacteria. Don't touch your face too much. Always wash your face with cold water as it reduces the irritation. Diet and hydration. Maintain a balanced diet, drink plenty of water, and limit your intake of sugary and greasy foods. Don't intake oily and processed food, as these can contribute to acne in some individuals. Stress management. Practice stress reduction techniques like deep breathing, meditation, or yoga. Keep yourself calm, as whenever you feel relaxed your skin muscles get relaxed, and in a stress-free condition you and your skin get fresh, as stress can exacerbate acne. Clean bedding and makeup brushes. Wash your pillowcases, sheets, and makeup brushes regularly to prevent the buildup of bacteria and oil. Keep in mind that you don't use others' makeup brushes. Wash your brushes as well. Consult a dermatologist, if your acne is severe, and severe inflammation, or causing distress, consider consulting a dermatologist. They can provide more targeted treatments, such as prescription medications, chemical peels, or laser therapy that would be good for your skin. Remember that it's essential to be patient and consistent with your skincare routine, and you should start to see improvements if you follow these steps diligently. Additionally, everyone's skin is unique, so what works for one person may not work the same way for another. If you experience severe irritation or worsening of acne, consult a healthcare professional or dermatologist for guidance. Thanks. Please like and subscribe my channel.